When we were at dinner just recently in Rotterdam, you were telling me you're a vegetarian. How's that going?
Oh, I can highly advise it to you. It's good for your health.
Full vego.
It's good for your health. I really see the benefits of it, especially as a surgeon, right? You're high performers, and you need to be aware of your lifestyle. And we have a big issues with a lot of farmers in the Netherlands, so we produce a lot of meat, which is mainly for the export, which I don't see why all the cattle have to poo here in our land to put the meat to Spain. So that's one of the things which I don't like as well, which will help being a vegetarian.
Welcome to Inside the Shoulder. I'm Kenneth Cutbush, and I'm joined by Dr. Bart-Jan Veen from the Netherlands. Welcome, Bart. How are you? So good to see you.
Thank you. Thank you. Nice to catch up. Great opportunity.
Which city are you joining us from now? Whereabouts in the Netherlands are you?
Yeah, well, I'm close to the German border. It's at the eastern part. It's called Enschede. It's like a small university town, but it has all the things you need.
Very nice.
Yeah.
And is that where you're working now?
Yeah, it's a nice, good, not academic hospital, but it's a great, a large regional teaching hospital, and that really, yeah, has some benefits for me considering research and the type of patients it's attracting. So yeah, that's good.
Very good. Now, you came to work with me in Australia as a fellow. Which year was that?
2020, it's
2020.
right here. Yeah.
It was just as COVID was hitting, wasn't it?
Yeah.
So you arrived with your family, and we went straight into lockdown, really, didn't we?
Yeah, well, we had a few months, so we had one of the parents visiting, and that was it. We were all by our own
Yeah.
the whole year. Yeah.
So tell me a little bit about how that was like, what that was like joining us in Australia with your family, preparing to come over. How confronting was that?
Well, not so much as confronting as we consider it as one of the best opportunities in life. You know, when studying and going through residency, you have your opportunities to go traveling, but it was always 1 or 2, 3 months. And so during my training, we had the plan, well, if I finish my residency, we want to go abroad for a long time, and this seemed to be the best opportunity for it. So yeah, we loved it. Did some months traveling in New Zealand, and then started in Melbourne. Bought a caravan and a big car, and then traveled all the way up with the surfboards and the two boys. Yeah,
So you like your surfing, don't you, Bart?
definitely. Yeah.
So where did you surf in Australia? What was your favorite place?
Well, our secret spot was well, close to Brisbane is Snapper. I'm not so much sure how much you're into surf spots, but Snapper is quite famous. But then up north, it's only a little bit more than an hour drive. It was Moffat's, which was less crowded, more like a sloppy wave, but excellent for my surfing experience, right? It being intermediate. So yeah, we love to go in there, eating fish and chips at the end of the day.
Right. So fellowship during the week and then surfing on the weekends, hey?
Yeah, one of the good things about the fellowship, right? It's all in
Yeah.
private practice.
But tell me a little bit about doing medicine in the Netherlands. What's it like? How competitive is it to be a doctor in the Netherlands? What do you have to do?
Um, I think in general we are a bit spoiled and a little bit lazy. Our European, especially the Dutch way, if you do your best at the high school, then you roll into your academic career, and if you are smart enough, you just pass your exams. But it's more like, well, the class from high school go further, and everybody goes to a certain place. The up north, I had my training, and so during university, and then when in, of course, I had some competition, and I did my best, but I didn't realize how much competition is when you enter into the world level of competition during your fellowship, after your fellowship, getting back, getting a full spot. So yeah, that made me push things during my residency. Halfway, I found out, okay, there's more than just going through and through.
What do you mean by world level of competition?
Well, Good question. But I mean, you go to international congresses and then you meet peers which are like you on the same age as far you're as in, and then you're getting impressed or enthusiastic more as like what they are doing with going abroad and starting with doing research. And well, that really pushed me to look a bit further than just sticking around with my local colleagues and friends, which are good and which you need to have to. But I decided that's more than that, just the Dutch way of things.
You mean you learned some of the Aussie way of doing things?
Yeah, of course, it's a strong competition, but also internationally, right? If you see how our young surgeons are trying to get up their career, and well, that motivated me highly.
And how competitive is it to do orthopedics in the Netherlands? In Australia, orthopedics and plastics tend to be the most competitive ones to get into. What's it like in the Netherlands?
Well, of course, surgical field specialists are hard to get into, but it's not impossible if you are motivated, stand up, start a little bit of research, but you don't have to finish always a PhD or something, which some other specialties have.
Yeah, right. Okay. Um, and your family enjoyed coming to Australia? What was that like? You had two boys at the time?
Yeah. Well, um, yeah. So as I said, we bought a caravan and did our traveling beforehand. So I knew I could go full into the fellowship and already had some experience, Aussie experience, and yeah. So we found a home there, and then we settled in. My oldest had to go to school, so that was also something different, right? He had to speak English certainly. So he didn't speak any word English, and then within 3 months he had the proper Aussie slang already. So we went all in the Aussie way.
Please share with us the Aussie slang that he picked up.
Well, I'm not sure it was slang or more strong accent, like where's me fine or something. As I
Yeah,
remember,
right.
you could say proper Aussie.
Now, when you're looking at fellowships, how did you decide to come to Australia? What was your thought process there?
Um, the thought process was on based on two paths. One is like deciding which way. So I knew I wanted to go internationally for my fellowship for next step in my career. I didn't want to stay locally or nationally because then everybody knows how it was, right? The further you go, the further you're going unknown. So if you say I was abroad, it's already a next step. And then I decided I want to go to an English speaking. So I decided maybe going for Canada because it's easier to pick up if you go to France or something. You have to speak French there. It's not the easiest language. Nobody speaks English there, and it's obviously highly regarded. But you end up being the seventh, eighth, ninth fellow in line that year. I wanted to have it specially. So, and then looking at the world map, where do they serve? Well, it was Australia, and then yeah, looked around, asked around, and one of the things I did properly with was really reaching out to current fellows at different fellowship spots back at Brisbane. So they had like a
Hmm.
sports match, which I was sort of interested as well. They have like a full public one as well, and then one other sports career. And so I had some information from different, and the good and the nice thing is of fellows, they know you want to get into, they want to help you, and they give you an honest story. So they don't want to sell you into it. They say, well, and then I reached out to one of you, which was one very enthusiastic, and well, from one led to another.
Yeah, I was very enthusiastic about your application. You had that passion that you wanted to do shoulder surgery. You could see it shine through that you had a dream that you were following, and it was so exciting to interview you. I was just we I was just looking back at my memories on my Instagram, and we were looking at this photo before. So we actually caught up in 2018, wasn't it? In Paris. I was there at a conference, and that's you and your wife Luce in 2018, 2 years before you came over. And it's one of my favorite memories. Of that photo. It's such a good. So fun to meet up with you a couple of years before you came over for the fellowship because you'd planned that fellowship out for some years beforehand.
Yeah, nice you find that one. Yeah, I have fond memory of that dinner as well because You don't know who Ken is, right? We only had a 5 minute chat during our interview, and we sent off several emails. And but in the end, meeting you in person really strengthened the decision, the good decision we made, I guess. But yeah, so it takes a lot of time, and you need to prepare for it. So as you mentioned, I was really determined to go there. So I took my time 3 years in advance, looking out what do you need to do because the good spots fill up early, right? And you need to be aware that you need your accreditation of your training, of your certificates, but also getting academic English. So the IELTS test, you need to be prepared to get to do certain stuff. So yeah,
How'd you go with the English test? Because that really is something that's quite difficult for the fellows coming to Australia, isn't it?
yeah, the best advice is get lessons, private lessons. There are heaps of like English students going abroad in your city as well, and just ask for private lessons. So I had 1 hour or 2 hours a week every week, and she studied with me and giving me writing uh task and stuff. So that really helped me to pass that exam at one time. So get it going, the application. And it's a tough one, but you'll get there. There's good help from the AOA and the Rex as I remember that there was one officer that you can contact all the time. Is this good? What's this next? Which stamp and stuff. So yeah, although it's a bit hard to get there, there's some good help.
Yeah, the Australian Orthopaedic Association certainly have a great fellowships group, and
Yeah,
they definitely help everyone, don't they?
it's a well trodden path. So that's also yeah, you recognize it talking to peers. You always have a few that also go to Australia. I asked them about their experience and what to do next, and even this week, one some general surgeon resident came to me. Yeah, you went to Brisbane as well. Well, I'm going as well, and then we started chatting, and he was enthusiastic, and I shared some of my memories. So yeah, so it really bonds as well, and everybody is happy to help who has been there in Australia or is there at the moment. So yeah,
Did you give them tips on where to go surfing?
if they want to, yeah.
So you one of the difficult things in the Netherlands is getting a job as an orthopedic surgeon once you've done all your training and fellowship. How was that for you, Bart? I remember it went pretty well for you.
It went well in the end, but I remember going for an interview being in Byron Bay. So in the middle of the night, I was sitting there in my shorts, wearing a tie, doing an interview online with some orthopod group in the Netherlands, applying for a next fellowship, and where some drunk surf dudes passing by and screaming birds, kookaburras. Well, I did a few interviews, but those were mainly fellowship, and there was one spot available for a permanent place, and that's where I'm at the moment as well. And also, look, the fellowship gives you a lot, but also one extra note, right, on your resume, like you have dedication to go the next step, and that's what it shows, going a fellowship abroad, and that really helped me get that position in a strong shoulder spot.
So you're now a shoulder surgeon in the Netherlands. How's that?
It's good. So, and well, being a shoulder surgery surgeon, it really well, with the help of my fellowship, I found out what it takes to get there. So you showed me it's a business, and that, I mean, in a positive way, that you have to brand yourself, and that's not really common in the Netherlands. And everybody's like, well, just act normal. That's enough. Just do your normal things, and that should be enough. A little bit of hips, a little bit of knee, and a little bit of scope. So I was dedicated to move aside the hip and the knee arthroplasties, which is not that common to go straight into solely shoulder. I do a bit of elbow and a little bit of sports knees, but it's main shoulder surgery now.
But tell everyone why the shoulder. What was it that excited you so much about the shoulder? What gave you that passion? Because I remember when you first applied for the fellowship, you knew you wanted to be a shoulder surgeon.
Well, I like to back in the day, I wanted to align up my whole resume, right? To stand up there, and I decided I'd rather choose for one thing than go for everything a little. So I started my PhD on shoulder surgery back in the days, And then I get enthusiastic because you're doing research on rotator cuff repairs and biceps augmentations. So I went to a hospital where there was a very skilled shoulder surgeon, and he helped me the first steps, and that makes you enthusiastic about the whole shoulder. And what I like, it's open surgery, it's arthroscopic, and that balance um, gives it a very nice day at the OR, but also in the running clinics, right? You have young, sporty people dislocating their shoulder. You have the older people with wears and tears of their tendons and with going for arthroplasty. And and that's the thing, right? We on all these three sort of groups of patients, we still don't know the best treatment. Talking about instability, I've learned the best way to do arthroscopic lattice, where there are heaps of discussion which is the best technique on instability, but also on arthroplasty. We're still so much evolving. If you compare that to our dear colleagues in other fields like hip and knees, well, that's not comparable.
Yeah, I sometimes tease my knee colleagues that, what do you talk about at conferences? Is it one bundle or two bundles? And shoulders is, as you say, is just an evolving area. The technology is coming in, and we are learning so much about the shoulder and being able to do so much for patients. That's what I find really so exciting about it.
Yeah, and I learned a lot from you that try new techniques, but also being able to judge them in the right way and disregard of them as well based on literature, your own experience, and well, I still follow you in these ways.
I sometimes tell people that, in conversations that I started off doing neurosurgery, and they're always, surprised that I would now be doing shoulders and not neurosurgery. Because I think to many people that sounds really exciting. But for me, the neurosurgery, yes, you could do some amazing things with people, but a lot of the time you couldn't. Whereas what excites me about the shoulder is that, shoulders, no one thinks about their shoulder until it's sore, and then they can't sleep, they can't work, they can't go to the gym, they have trouble picking their kids up, and it uh, just stops their life. And in shoulders, unlike neurosurgery, we can almost always give them back their life by actually fixing their shoulder for them. And I think that's what I find so rewarding about the shoulders. What's your experience with that, Bart?
Yeah, as well, and you need to be a sort of people's doctor because you need to consultate them beforehand, and it will take some time together to get you to full recovery. It's not like I put a hip in and next day you're off and you're seen by some physios and then you send off the rest of your life happy. No, it will take 1 or 2 years sometimes with some of these repairs. And then you need to listen to people, know what they are doing, and then you need to support them in the right way, see them a few times afterwards, and you need to carefully and you need to know when to intervene again, like talking about capsular releases.
Mm.
Sometimes you need to offer them to get them to the next level, and don't just send them off to a physio and don't see them again. No, you need to follow up on them. And I think that what makes it a sort of different way of surgeons compared to other colleagues as well in the OR, right? You need to have some, um, how do you say it in English properly? Um, you need to spend some time on difficult situations. You need to be stay calm. You need to stay cool. I've got these colleagues like looking at all these sutures and they just run off and they get crazy. No, you need to stay cool and finish your OR, and that's what I like as well.
And you learnt that from shoulder surgery.
Yeah, being a shoulder surgeon, you need to be patient with yourself and you need to be dedicated to finish things off.
Yeah. Yeah, and you mentioned the surgical releases, and that really changed my life. Learning how to do the surgical releases, the arthroscopic releases for patients that didn't get all the movement back. Once they've finally their rotator cuff tears healed, or their labral repair is healed, and that 12 months down, well, 12 months down the track, still very tight in the shoulder, you can go and release them and give them their movement back, and that really changed my life when it came to shoulder surgery.
And other way around, it changed my life seeing you do this stuff and deciding to it, and that it really helps people. Because when I came back, I see some definitely senior colleagues just doing the standard stuff, and you don't need to do it all during your fellowship. And that's why everybody's I hear somebody choosing for public positions fellowship, because then I can make some meters in the OR, really know how to perform surgery. But surgery is not about the incision; it's about decision. You need to see all these type of surgery within a shoulder, and that's what the fellowship about. It really shows you from very basic to very advanced things, and the whole palette is it will be, you will see that in 1 year. And yeah, well, that really helped me to kickstart my career in the Netherlands. I remember doing a Hegel repair and then deciding we need to stop arthroscopy. We need to go for Hegel. Open up, bringing the open stuff. And my senior colleague was looking at me. What are you doing now? We can just leave it. It's a small tear. No, this is a Hegel and we need to fix it.
Yeah, yeah, because they have a haggle, it won't be any good. So yes, you have to.
Yeah. And you won't learn it in books to make this decision. You can read so many shoulder books. You need to go into a fellowship that really shows you all the things that can happen.
So where's your career going now, Bart? Are you doing arthroscopic lattice? What sort of are you doing? Open or arthroscopic lattice? What's on the horizon for you?
Well, professionally, yeah, but what's on the horizon? So I'm almost at my 5 years mark now, and I had some goals for me. So, and they are going good, and some are going better. So I'm locally really getting recognized as a shoulder expert. So I'm getting specific referrals, second opinions more, which really which I like and which I'm promoting for getting into contact with colleagues, with physiotherapists, GPs, and well, that really pays off. Nationally, I'm active in the Dutch Shoulder Elbow Society and developed some guidelines. We were involved with that one. And internationally, I'm in one of the committees of the Shoulder Elbow Surgery European Shoulder Elbow CSEC. So we were in the Congress where we met again, also in Rotterdam, which was very nice. So yeah, that really pays off, right? And that also helps that have been on a fellowship abroad. That's one of the legacies which you think you underestimate choosing a fellowship. You're like, yeah, I'm gonna learn something. No, but also the path afterwards. And technically, yeah, well, on this, you asked me specific about arthroscopic lattice. Well, I'm really respectful for you, and I see if how how difficult it is and how smooth you are doing, but I know you are a skilled surgeon. So I decided when I came back, haven't seen any open lattice. I first want to learn my proper open lattice. So I'm now doing it partly arthroscopic, and I'm now starting a study on more, which I think can be beneficial as well for my patient group, which are not collision sports, but they do have bone loss. I'm really looking into free bone blocks because I think it has the best of both worlds, offering stability with bone,
Hmm.
which you can do metal free and which you don't have to open the subscap.
You told me that you're involved in the Dutch Orthopaedic Society or the Dutch Shoulder Society.
Yeah, the Dutch Shoulder Society. Yeah.
How's that journey going for you?
Yeah, the journey is going good. And they obviously they are already asking sometimes what's next within the, and they see that we are enthusiastic, I am enthusiastic, and so I getting a few tasks and I'm always present at the meetings, and that's what I like. So at some stage I think I want to apply for the board, not sure if I can make it, but that really one of, but being there, and that's with all things in life, it will ask for a certain commitment. So I'm not sure if I can give it right now with having small children running around, and it's always a position for a few years. So I really have that in mind as a dot on the horizon for me, but not in this coming year. But it I really want to apply for it, yeah, and to share the shoulder love to young surgeons and showing around and promote it during in the Dutch Orthopedic Society as well, promoting it. Yeah.
Now, how's family life back in the Netherlands for you? 3 children, 2 boys, a girl, your wife. How's that all going for you?
Yeah, well, and that's what the fellowship teaches you as well, right? If you just take your family from somewhere, you will settle in. You can make new friends. The boys will find new friends, and yourself, as long as you are a team, you you can team up and settle in on a totally different spot. So that really reassure me getting back in the Netherlands. We can find a nice space. We can find a nice place, meeting new colleagues, new friends. We can settle in. So yeah, and then life is going good here as you're settling in now 5 years down the line at this place, and definitely want to stay here with, enough possibility as well. As I mentioned, it's a university city, so we have a lot of students going running research projects. I even got now one PhD student doing some very interesting research projects, which are really on the edge of orthopedics versus very technical innovations like virtual surgical planning, 3D, really advanced 3D planning, which obviously I've learned during the fellowship, right? And I
Yeah.
just took all the knowledge as far as I could and then went on it and then it developed further.
Do you boys still speak with an Aussie accent?
Well, it's quite hard to maintain that, but they still know, especially the oldest one really knows how to read, still reads English books, so I try to keep up with that. I
Hmm.
speak English to them once in a while, and we have all the Netflix and Disney movies running in English, so I hope that will give them a little bit of still English.
And when we were at dinner just recently in Rotterdam, you were telling me you're a vegetarian. How's that going?
Oh, I can highly advise it to you. It's good for your health.
Full vego.
It's good for your health. I really see the benefits of it, especially as a surgeon, right? You're high performers, and you need to be aware of your lifestyle. So I try to keep up with my sports, going for as the advice goes is, and I think the vegetarian life really helps me to stay healthy, and we have a big issues with a lot of farmers in the Netherlands. So we produce a lot of meat, which is mainly for the export, which I don't see why all the cattle have to poo here in our land to put the meat to Spain. So that's one of the things which I don't like as well, which will help being a vegetarian.
So, Bart, what advice do you have for young surgeons wanting to do a fellowship?
Do it. I think when you're going to go for a fellowship, it's more than do it for it. You cannot see upfront what it gives you when you're leaving. You have a shoulder family, which is a legacy, which open doors for you. I still running cases with you guys. Running, I mean, I send up cases for which I don't. Um, how do you say? Difficult cases which I want to discuss with colleagues, and it's just you need people who are trained the same way, who think the same way, which you feel comfortable to be vulnerable as well, to show you the cases, and that's one of the things I definitely like. So we have the WhatsApp group, and there we put cases on, and then you get great advices by people you know are trained in the same way. With a high standard of shoulder knowledge, and that really helps me pushing forward. And also on congresses and stuff, a fellowship really opens doors. People recognize you. Hey, you were the fellow this and that.
Yeah, you mentioned our WhatsApp group. That's pretty good, isn't it? The WhatsApp group that all the fellows are on, and it's really interesting to see. You know, because when it first started off, a sort of case would go up, and people wait for me to make a comment, but it's not like that anymore. It's a very live conversation, isn't it? You guys just are telling each other what to do, and we've got fellows now from all over the place. You know, from Nepal and Mexico, and from Lebanon. We have. Joma from Lebanon with those war cases he puts up, and they're
Oh,
just fascinating, aren't they?
impressive, fascinating to see it, indeed.
Yeah, he's doing some pretty good stuff there.
Mm-hmm. Mm-hmm. Yeah, and I got a list on my on our local system running like patients I need to discuss with my Australian friends. I really discuss it with Australian fellowship WhatsApp group. Just I need to confirmation. Am I doing the right way? Because you don't have that many
Yep,
like reference in some cases.
yep. Tell me about what was the most valuable lessons you learnt during the fellowship? Not just necessarily in the terms of actually the medical side of things.
Um, what taught me well the best life lesson is that when doing stuff that you can relocate yourself and your family, saying bye to your friends and family, and then you just spend the whole year in a wonderful city and have one of the best years of my life. And I didn't realize that when preparing for it. I knew it would be a good year, but that I thought it would be struggling with not having your friends or family. And I know you will be seeing them later on, but Yeah, and it really livens up your life, being able to go somewhere else.
Tell me, were there any difficult moments during the fellowship? Did you get homesick?
Homesick was not really an issue for me, as you were noticing. I like to surf, and we had the weekends off, but I think sometimes it was not a struggle because I like doing the shoulder surgery, but it's the work-life balance, which is also important. You have your wife, I have her over. She wasn't able to work there in Australia, so you need to be mindful as well that you spend your time as well. So I remember sometimes that I just stood up after a whole day of clinics and I knew you or she was still running the clinics and I was like, yeah, well, I needed to go to my family. And I think that was maybe sometimes a bit posh, seeing you still running your basement. On the other hand, I thought, well, I need to have this balance as well, which we are used to do it in the Netherlands. So yeah, that was sometimes, yeah, difficult. How do you preserve your own time versus being in the fellowship? And you need to realize what's beneficial at certain stages, right? I don't think you regarded me less going in 1 hour earlier, but then I was able to see my son and heard how it was for him being at school. Because that's the thing with medicine, and especially also with shoulders, and it never stops, right? You can always go on and go on, and especially in you and me are enthusiastic about our job and our the field. You can spend endless time on the shoulder, which I like. But sometimes you need to stop and go to your family, go to your partner.
I agree with what you say. I mean, I like to have that passion for what I do at work, but I also like to have passion to see the family. You know, see my child. You know, it's such a rewarding time to spend time with my little girl Lulu.
Yeah, great to hear.
Yeah.
Very good.
You did the fellowship with Andrew Kerr from Scotland. Do you still catch up with Andrew?
Oh, definitely. So we during the congress we had a lunch, and he invited me to do some presentation at his course, and sometimes we WhatsApp. But especially during that year, that you have somebody who is in the same position coming with his family, so we catched up all the times. And walking back home, I remember just calling him for an hour, just discussing our day because you're in the same situation. So having some fellow peers that really bonds for life. So I can call him up and go over here, and definitely he would um would give me some great nights there.
But long term, how do you think that the fellowship is going to influence your practice in medicine and you know your approach to things back in the Netherlands?
Oh, I changed my view on medicine totally, in a general way, but also on shoulder surgery. Like, you were trained like everybody, it's a banker's or a shoulder arthroplasty, and that's it. And then it opens a whole new world of possibilities. So that really skips 5 or 10 years in your career during one having one fellowship on board on your resume, spending 1 year. That really kickstarts the rest of your career, and then also looking at medicine and your job, that you can go all in, and that it's not a bad thing to do, to go all in into one joint, and you you don't want to stay in doing a bit of hips and a bit of knees and I still do a bit of trauma because that gives me the highest chances to get a job. No, you and Ashish really showed me you need to go for one joint, and that really helps you.
Yeah, I agree with what you say. You know, I made that change from being an upper limb surgeon to doing shoulder surgery, and it was best choice I made. You know, and I got into it. I did that just as the revolution in shoulder surgery was coming through with all the arthroscopic equipment and the arthroscopic anchors that we've got, where rotator cuff surgery in Australia went from open to fully arthroscopic. And you know, I haven't done an open rotator cuff repair in years. I think 10 years now, and it was so exciting to be part of that evolution that came in shoulder surgery. And it's still, as you said, it's still going. We still have not sorted out everything in the shoulder.
Yeah, and that makes it such a magnificent job, right?
Yeah.
Definitely. Yeah.
And still with the shoulder replacements, we're still on that learning curve of shoulder replacements. For me, particularly with the reverse shoulder replacements. And have you found that? Where are you with shoulder replacement surgery right now? What's your progression there? What's the evolution?
Well, the evolution comes to planning, obviously, which is there already, but I'm really pushing myself, look closer, and especially on the because uh, I plan every case,
Hmm.
but I don't make any guide. Not always a guide, but I always have it planned, and I'm started to looking way more at RSA angles, and I developed some guides for revision cases, which are obviously very tough to do so, but that really makes me prepare for my revision surgeries, which I don't have that often, but when they are there, I have my 3D lab working around and making guides, and that really helps me to don't have any surprises.
But what advice do you have for young people wanting to do medicine now? What would you say to them?
Well, it's not a shame, to to spend your life in medicine, and especially not in a hospital, because we now nowadays see Gen Zers, they don't want to work in a hospital because they consider it as a harsh life, uh, looking at the hours spent there. And I think we are already very well balanced on work life from my point of view, especially compared to colleagues in Europe or in Australia. Well, it's common to work only 4 days a week and have 1 day for your administration, but it ends up being at home, being a daddy, getting your kids from school, uh, well, and still having a nice salary. But the Gen Z is considered working until 5, 6, not normal or something. But I think, yeah, we need people in the hospital, and I think it's totally different compared with first line. That's how we call it in the Netherlands, like the GPs or running at
Hmm.
corporate doctors you have, if you know what I mean, with looking at disabled people. Not saying it's wrong, but we need people in the hospital as well. And now it's regarded as those guys are just not working so hard. Well, I don't think that's the case.
Thanks, Bart. That was fun. So good to see you. We'll have to do
Oh,
it again. I've got to come and visit you in the Netherlands.
yeah, and I'm still not sure if I want to go back. If I'm not sure if I will be crying a whole month. I
If
want
you
to
bring a
stay
surfboard.
here. I want to serve. Stop it. Oh
Yeah.
man. Yeah, it's nice catching up. Sorry, didn't realize you were catching up with Freak as well. We didn't connect this week, so I wasn't aware. But all fine.
We'll do it again. I'll be over at CSEC another. Where's CSEC this year?
Yeah, we'll be in Barcelona.
Yeah, Barcelona. When's that? In September, is it?
Yeah. And are you running more today? Are you good?
5 today.
Jeez, all this all these happy fellows.
So, Bart, great talking to you. Um, so that's inside the shoulder. Thank you, Bart, for coming on and joining me for our conversation. I've really enjoyed it.
Thank you, Ken, for this night invitation. It really pushes me, gives me all these fond memories of a great year there,
Yeah, same.
especially on a personal level, but also on on the shoulder level, right? Yeah. It was
Yeah, I
really
think you were the one of the first fellows where the shoulders fellowship that I was running really sort of came to life. So so thank you, Bart. I have really fond memories of working with you and with Andrew.
well. Likewise. Thank you very much, Ken.
Thank you for joining me on Inside the Shoulder with Dr. Bart-Jan Veen. If you enjoyed this podcast, please share it and like it on your favorite podcast platform, whether it be Apple or YouTube or Spotify. And please join me and subscribe to the Kenneth Cutbush YouTube channel so you don't miss any of the episodes. Thank you for listening.